Okay.
All right, so I think everything looks fine in the heart. There's one tiny little defect that is normal in 1 out of 5 people. So I'm going to explain that with a picture.
Okay.
So normally the blue blood comes back to the right atrium. The right ventricle pumps it out to the lungs through the pulmonary artery. It gets oxygen and it comes back in the left atrium. And then the left ventricle pumps the blood with oxygen out to the body through the aorta.
Yes, ma'am.
So normally all the blue blood stays on the right side, all the red blood stays on the left side.
Yes, ma'am.
When babies are in the womb, blood doesn't go out to the lungs because they don't work. So there's a big hole between the upper chambers. So the blood with oxygen can come from the mom and go across that hole out to the baby's body.
Wow.
After we're born, a flap closes that hole. So in about 20%, the flap closes, but a little bit of blood squeaks across.
Okay.
That's called a patent foramen ovale. Again, 20% of adults have that. We don't do anything about it. We don't follow it. It doesn't really cause a murmur or a sound. So I'll listen to her as well to see if I hear a murmur. But it's nothing to worry about.
Okay.
There is, if you read about it online, you will read about some adults having that closed. And if she were, so some people have clotting disorders where they're prone to get clots in their legs. So if she were to be one of the, 500,000 or something people who has a clotting disorder, and in the future as an adult she gets a clot in her leg, there is a chance that a piece of that clot could break off and then it could find its way across that hole.
Okay.
So in the adult world, they close those holes if they think that a clot has broken off and gone across there. It's not common, so we don't close the little small ones because they're unlikely to do that, and 1 out of 5 people would walk around with a device they don't need.
Okay.
Questions? The nurse was saying no symptoms we're worried about, right?
Yes.
Looks like she's growing good. And you are a cute one. I know, I heard you were a cute girl. Listen.
I'm gonna step back over here, Doc.
Oh, that's Howie. She does have a little innocent sound. It's called a Stills murmur.
Okay.
So murmur is just the medical term for sound other than the bowels closing. So when we listen, we hear bump, 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 bump. In her case, I hear a little bump, sort of sound.
Okay.
And that's caused by vibration in one of these valves, probably the tricuspid. So it vibrates a little bit, makes this little vibratory sound, but there's nothing wrong with the valve.
Okay.
So if somebody hears the murmur, it's going to be louder when she's sick, softer when she's well. If somebody hears a murmur, you should just say she had a normal echo when she was, how old was she?
3 months.
3 months old. When she was 3 months old.
Okay.
And that will tell them there were no significant holes, all the valves were normal.
Okay.
The murmurs probably doesn't mean anything.
Okay.
All right, and her EKG looks fine, that electrical one that we did.
Okay. So we don't have nothing to worry about.
No follow-up, no, just makes a little innocent noise, has a little tiny squirt of flow across the top, nothing to worry about.
Okay, something she'll grow out of.
Well, the murmur, we don't hear those sounds quite as much in teenagers and adults, but even some adults have innocent murmurs. So
Okay,
it may
yes,
always
okay.
be there. But that doesn't matter. And that PFO, whoops, sorry,
Okay, I get it.
that little patent foramen ovale, it's possible it will seal off, but it may always be there as well.
Okay.
But it doesn't matter. I'm gonna put that there so she doesn't pick it up.
Okay. So I appreciate you.
No problem. Nice to meet you. Sorry you had such a long drive and had to get behind an accident and everything else.